So we put stents in the heart arteries, and we have several generations of stents. The stents have gotten so advanced that it's very hard to make them better. The questions that we remain to ask is how we manage the medications on the patients that receive stents, drug-eluting stents in particular, which are probably the mainstay of therapy for coronary disease. And there's going to be several trials presented here trying to answer that question. There's a very important trial being presented at the meeting called the Augustus trial, in which they're going to try to evaluate how we should be treating people who get stents and have atrial fibrillation at the same time. So they need blood thinners, they need dual antiplatelet therapy for the stents, and they also need anticoagulation for their atrial fibrillation. So what is the best way to manage those patients? And there's a study that's trying to answer that question, comparing it's a factorial design, and basically they're comparing whether people should get a NOAC called apixaban versus warfarin, and a 1 antiplatelet versus 2 antiplatelet medications. So those things are going to be discussing here about the medical therapy of that. Everything in medicine that we do is trying to do either one of two things for a patient, either trying to make them live longer or trying to make them live better. And every time we do these studies and all that, we try to answer that question of, is this therapy going to improve mortality? Or is this therapy going to improve the symptoms of the patient? And that's how we compare everything that we do, everything new that comes, we compare it to a standard of care and decide whether those things are necessary or not. And in terms of coronary disease, which is what I do every day, there's nowadays a lot of debate on when people have stable coronary disease, whether they should be just managed medically with medications, or they should have an invasive strategy using stents. Obviously, I'm an interventional cardiologist. I will tell you everybody needs a stent, which is not true. But how do we use this data to put it into real practice and try to do what's best for every single patient? Meetings like this is when you hear the insights from every single expert in the world, and you try to decide what's best for you as a physician with your particular population of patients.